Hello, my name is Lindsay Robert, and this is my video assignment for Module 7 of Child Psychology, a review of the efficacy of cognitive behavioral therapy, or CBT. CBT is a style of intervention that proposes that distress and mental disorders develop from cognitive factors known as schemas. With CBT, treatment for behavioral and emotional problems target the misconceptions that individuals have about the world, themselves, and their future. By changing one's automatic thoughts, problematic behaviors can also be changed. In utilizing CBT to address a variety of presenting issues, specific protocols have been established to address the factors unique to each disorder. While different in nature, these protocols do share the same core approach to treatment. For all disorders, the treatment goals are to reduce symptoms and improve functioning. To achieve this, clients must take an active role in the process of solving their problem and challenge their maladaptive cognitions. But is CBT an effective approach to therapy? The article, The Empirical Status of Cognitive Behavioral Therapy, works to determine the efficacy of CBT. This is accomplished by surveying meta-analyses that examine the application of CBT to a number of presenting issues such as schizophrenia, substance use disorder, bipolar disorder, depression, and general stress, among other conditions. This review determined that CBT is most effective in treating anxiety disorders, bulimia, somatoform disorders, stress, and anger control issues. CBT has also shown to have a higher response rate when compared to other treatments. In making these determinations, articles regarding CBT's efficacy were located by searching a number of databases, including PsycInfo, PubMed, and the Cochrane Library, using keywords such as meta-analysis and cognitive therapy. Search results were narrowed down to 269 viable meta-analysis articles, which were then categorized by disorder. The categories reviewed include addiction and substance abuse disorders, psychotic disorders and schizophrenia, depression, bipolar disorder, anxiety, somatoform disorders, eating disorders, insomnia, personality disorders, aggression, criminal behaviors, general stress, distress due to medical issues, chronic fatigue and pain, and pregnancy complications. In treating substance abuse, CBT's efficacy depended upon which type of drug was involved. While CBT was effective for nicotine and cannabis addictions, it was not helpful for treating alcoholism. With psychotic disorders and schizophrenia, CBT was found to be effective for increasing positive symptoms, but not as effective as other treatments used for chronic symptoms and prevention of relapse. CBT is shown to have mixed results for treating depression. Some of the evidence presented was strong, while other articles reported weak results. However, it is believed that some publication bias may have been involved, impacting study results. In the short-term treatment of bipolar disorder, success rates were small to medium in size. The long-term results in comparison to other interventions are unknown, and evidence of CBT's efficacy over pharmaceutical treatments is limited. Yet, CBT seems to be effective in treating the depressive symptoms of bipolar disorder. Anxiety disorders were shown to be successfully treated with CBT, especially regarding obsessive-compulsive disorder. Social anxiety, panic disorder, and post-traumatic stress disorder treatments results were promising, as efficacy rates were medium to large in size. CBT treatment for somatoform disorders like body dysmorphia appears to be successful, as efficacy group sizes were medium to large. Unfortunately, trials with larger sizes are necessary to better prove success rates when compared to other treatments. With bulimia treatment, CBT was found to be more effective than other therapies. However, results for treating other eating disorders is not fully understood. Insomnia treatment was similar to bulimia in that CBT was proven more effective than other interventions. CBT was successful in improving both the quality of sleep and the amount of sleep time. Some studies showed effective treatment for sleep problems in individuals over the age of 60, but the long-term effects of these treatments are unknown. CBT outcomes for treating personality disorders vary greatly due to different measurement methods and the presence of comorbid disorders. Yet there is some evidence that CBT is more effective than other personality disorder interventions. Aggression and anger have successfully been treated with CBT, but more information is needed when comparing CBT with psychosocial interventions for anger. Additional research is necessary to determine if CBT can be used to treat criminal behaviors. With stress management, CBT seems to be more effective when compared to other treatments, except pharmaceutical methods, and more research concerning occupational stress is necessary. The research collected on CBT treatment for chronic fatigue, pain, and general medical conditions raises some concerns due to small sample sizes, poor study methodology, and grouping of CBT with other therapies. These roadblocks made it difficult to determine efficacy for most of the medical conditions that fall under this category of disorders. Lastly, research on treating pregnancy complications and hormonal conditions with CBT is too scarce to determine efficacy, but use of CBT seems promising when compared to pharmaceutical interventions, which could be harmful to the patient. In summation, despite the need for more research in some areas, CBT is effective in treating a number of disorders, especially anxiety. These results have led experts to believe that CBT should be utilized more widely throughout the world.